Hey guys, my disease is breast cancer, so without any further ado, we will get started. For the introduction of this disorder, I'm going to start by giving you guys a bit of history about breast cancer. There is an ancient Egyptian medical text, mainly about trauma surgery, named the Edwin Smith Surgical Papyrus that dates back to 3000 to 2500 BCE. In this text, it was discussed there is 8 cases of tumors or ulcers on the breast. It explained that they were removed by cauterization. However, they also did not have any other treatment for that. There is evidence that in ancient Greece, people offered objects in the shape of breasts to the god of medicine, which I kind of thought was a cool little fact because they would have asked the gods to heal like breasts and that sort of thing. Here are a few milestones of breast cancer research. So the first radical mastectomy was performed by William Halsted in 1882. In 1898, Marie and Pierre Curie discovered radium, which is the radioactive element that we all know is used to treat cancer now, like in radiation. A drug called tamoxifen was created to be used in breast cancer treatment as well. This is an anti-estrogen drug, and it was developed in 1978. And over the years, different types of drugs were created and approved by the FDA and are still used to treat breast cancer today. So moving on to the etiology of breast cancer. So there's not one specific cause of breast cancer. Many factors can increase the risk of being diagnosed with breast cancer, and these include age, family history, genetic predisposition, obesity, excessive consumption of alcohol, early onset of menstruation. Like other cancers, breast cancer starts when normal cells are mutated into abnormal cells. Since these cells are mutated, they do not function properly and can divide out of control and grow rapidly. This usually leads to the formation of a tumor, and as the tumor gets bigger, it starts to involve the surrounding tissues and it can attach to the skin. So moving on to the pathophysiology, usually breast cancer begins in the duct system, but can also come from the milk-producing structures or the lobules. The tumors can involve the tissues around it as well as attach itself to the skin, like I mentioned earlier, and this can cause dimpling. At the start, the tumor is not fixed anywhere. However, as the cancer progresses, it'll become fixed and not move around, so it won't be able to move around freely anymore. Most tumors are solely estrogen, and these tumors usually metastasize with the lymph nodes in the axillary. A lot of the time, because diagnosing breast cancer isn't done at its earliest stages, a lot of the time the lymph nodes are already involved um, in the cancer or with the cancer. Breast cancer can metastasize quickly, moving to the lungs, the liver, the bones, and the brain. So next, here are some clinical signs and symptoms of breast cancer. So oftentimes a hard mass is found in the breast or the axillary, as well as we can see alterations in the size, the shape, or the feel of the breast or the nipple. And that can include redness, dimpling, puckering, that kind of looks like the peel of an orange. There can also be drainage from the nipples, and that can be bloody, clear, green, purulent, as well as thickening or swelling of just part of the breast. There's also signs that metastasis has occurred, and that's bone pain, skin ulcers, edema of the arm on the same side as the affected breast, and weight loss. So as the tumor grows, this is when the symptoms start to show. So a lot of the time, breast cancer is asymptomatic just because the tumor hasn't gotten to the point where it'll start affecting the patient yet. And so, like I mentioned before, dimpling will occur because the tumor has attached to the skin underneath that area. Changes in the appearance or the feel of the breast occurs because of the tumor beneath it. And certain discharges can mean different things. So certain discharges can actually mean like different types of cancer and that sort of thing as well as just for different problems too. And so moving on to the treatment of breast cancer. So breast cancer requires an aggressive approach. However, usually the outcome is positive if the cancer was detected early. So the treatments include chemotherapy, which uses cytotoxic drugs. So chemo helps to shrink a tumor before surgery. It helps to destroy the cancer cells that were left after surgery. And it also helps to treat cancer if it comes back. Radiation is used. So radiation is when like high levels of energy rays are used to kill cancer cells. Surgery to remove the cancer tissue, so like to remove the tumor and any surrounding tissue that it affected, as well as hormone therapy, which blocks the cancer cells from getting hormones that help them grow. A drug that's used in the treatment of breast cancer, like I mentioned earlier, is tamoxifen. And it's used before and after menopause. And like I said before, it's an anti-estrogen, so it helps, it lowers the levels. There's fulvestrant, which is an injection that prevents estrogen from attaching to the cancer cells. There's also, there's some medications that are used to enhance the body's immune system and encourage them to help destroy the cancer cells. There's that really long word that I'm not going to say because it's really hard. And then there's another one that also does the same thing to help kind of like wake up the immune system to help them attack and destroy the cancer cells. A lot of the time, doctors recommend support groups and counseling just because of how much stress and emotion and just because of the intensity of the situation. Oftentimes, it's so hard. So it's good to kind of have an outlet and be able to talk to other people who are going through the same thing. So these are my test questions. So question 1, where are the most common areas breast cancer originates from? A, lobules and duct system. B, lobules and axillary lymph nodes. C, areola and cervix. Or D, all of the above. So I'll give you guys 5 seconds. The answer is A, lobules and duct system. Second question, which of the following is a risk factor for breast cancer? A, diet. B, late onset of menstruation. C, excessive consumption of alcohol. Or D, excessive exercise. And that is C, excessive consumption of alcohol. Number 3, what treatment is the best treatment for breast cancer? A, chemotherapy. B, hormone therapy. C, radiation. Or D, all treatments above are necessary in a positive outcome. That one's a bit of an easy one. I hope you guys all get it. That is D. And for my true or false, so true or false, a hard mass in the breast, drainage from the nipple, and weight gain are all signs and symptoms of breast cancer. False. So the reason that one's false is because it is weight loss and not weight gain. So that is all I have for you guys. Thanks so much for listening. If you guys have any questions on the topic, I did quite a bit of research, so I would hopefully be able to answer any of you guys' questions, but thank you for listening.